Good evening, ma'am.
Good evening, Shaheen. Shall we start?
Yes, ma'am.
Okay. So, in last class, we talked about system approach, and in this class, we'll be talking about medical transcription. Okay. Can you see my screen?
Yes, ma'am.
Okay. So, now coming to like what exactly is medical transcription is basically this. The simple definition would be it is a process where we convert voice recorded medical reports which are actually dictated by health professionals into certain written documents. And as last class also, I gave a brief about like what all these reports can contain. So they can include lab results, clinical notes or summaries, surgery notes, and some other details about patient's medical history and care. Now, if we talk about like why it is needed, for by whom it is needed, and how it help us. So first of all, if we talk about like who, so doctors, nurses, and other healthcare providers, they basically dictate their reports, which are then transcribed by technical people who are medical transcriptionists in this case. Then what they exactly do? So medical transcriptionist basically they have a understanding of medical terminology, and they can like translate whatever these whatever is dictated by the healthcare professional. They can actually translate these things into very concise and formatted written reports. Sometimes they use certain software also to assist in transcription, but actually as a medical transcriptionist they are responsible that whatever they are converting or writing, it should be accurate, and a complete information should be reflected in the final document. Why we require these transcriptions? So basically to have a accurate medical records which are very important so that we can provide quality care to patients. This actually ensures continuity of care between different healthcare providers, and they can help in proper diagnosis and to have treatment plans for the patients. These sometimes also serve as medical legal documents as they contain each and every information about patient's history or the treatment and everything. So if we found any medical, any like errors in these medical documents, so they can have serious implication. So maintenance of these transcripts and accurate information is very, very important. Now coming to application. Okay. Medical transcriptions, they can be used in like various setting within healthcare industry where we need any data related to patients medical report basically which are required in a written document, you can say. Some of the areas are like hospital and clinics, because in these settings it is especially required by the doctors. They require it for reports, discharge summary, operative notes, progress notes, and consultation notes also. Coming to specialty practices, actually here it acts as a very important document because specialists like oncologists, cardiologists, or dermatologists, they rely on medical transcriptions uh, to have a genuine on accurate patient history and to decide the plan of treatment. Coming to emergency department, so when patients they have a medical history record, so in case of emergency, it helps as a referral document, because it can give a insight to patients' assessments or a history and whatever treatment procedures. the patient was having, and any discharge instructions which are mentioned in these documents. Coming to radiology and imaging centers, so radiologists use medical transcription for the interpretations of X-rays, MRIs, CT scans, and other diagnostic images. Coming to laboratory investigation, so pathologists, they dictate their tissues and other lab tests, which are then transcribed into written documents. When we look at outpatient surgery centers, so in this case, medical transcription is used to document surgical procedures performed in outpatient setting. After COVID, we all know like telemedicine has proven to be very useful. So in case of telehealth, whenever there are any diagnosis or treatment suggestion by doctors in virtual doctor-patient relationship, in this case, actually transcripts, they play a very important role. So in this case, these help in accurate record maintenance. Medical transcription can also be used in medical research. So, research studies, they actually involve a lot of data collection, analysis of patient data, depending upon the objective of the project. So, when there is a medical record for these patients, so they help in they help in acting as baseline for research findings, and all the observations, they can be converted into written reports. uh, if we talk about medical coding, so accurate medical coding is very important, and in this basically diagnosis and procedures, they are translated into standardized codes which are required for billing purposes, and also they help in completion of medical records which are generated through medical transcription. As I told you, these medical records or transcriptions, they can also they can also be considered as legal documents. So for legal proceedings, medical transcriptions may be required to convert dictated medical records into format which is actually considered as legal evidence. So we can say medical transcription is actually plays a very vital role in all healthcare settings, because it ensures that accurate, detailed, and well documented medical records are created. And how it plays an important role? Because this supports effective communication between healthcare providers. It also contributes to better patient care, and it facilitates various administrative as well as legal processes within the healthcare system. Just a second. Let me plug my charge. Okay, so like medical transcription definition and use, is it clear? Any doubts till now?
Um,
Is it okay? Shall I move forward?
yeah, please.
Okay. So now coming to what are the benefits? Okay. So, okay. First benefit is improved accuracy and reduced errors. So medical transcriptionists, basically they are trained in medical terminology, and it ensures that whatever complex medical information is there, it is transcribed accurately. So This accuracy, it helps in reduction of errors that can actually that can lead to negative consequences for patient care. So accuracy is very important, and accurate information is provided to doctors or any healthcare staff which require patients information. Second is increase efficiency and time saving. So basically, doctors and nurses, they don't need to serve a lot of documents. They don't need to go through lot of histories, and sometimes in handwritten reports, like it's not that understandable. Also, sometimes it's like all jumbled up. So in those scenarios, doctors and nurses, they basically it reduce their time. Okay, they need to spend less time typing out reports and focusing on patient care. This basically improve overall workflow and efficiency within a healthcare facility. They can talk to patient and like show an empathetic attitude also, and basically the patient can share about their sign and symptoms. Doctors actually can do their work. Like I told you, like in nowadays in many medical setting, the doctors, they are required to enter each and every information about the patient on software. So somehow it diverts their attention towards patient. So when we have a medical transcription is there, so it actually helps for doctor focus toward his patients. Okay. Next point is reduce physician burnout. So, um, dictating reports, actually it helps to free up some valuable time for doctors, and somehow it also help in reduction of administrative burden, because they can actually focus on their clinical practice rather than giving too much time to these administrative procedures, all the paperwork. So it helps to like reduce the burden. Next point is enhance patient care. So mm basically, when we have some accurate and complete medical reports, they help in providing high quality patient care. Okay, so medical transcription, basically it helps that whatever information which is relevant about patient medical history are documented correctly, and this allows healthcare providers to make informed decision about treatment. Now, coming to improved accessibility of medical records. We all know that EHRs, or electronic health records, they play a very important role. They are ready reckoner for any patient's history or what all investigation the person has gone through. So when we have transcribed reports which are readily available in form of EHR, it helps to improve accessibility for authorized person whosoever is like involved in the patient care. So this basically help in communication also, and also like in collaboration with other healthcare providers. So, for example, like in elderly population, when they have EHRs which are like transcribed, so it helps in management of chronic disease also, and it's like a ready document in which the doctor can refer to the history of patient. Also, they can plan accordingly. So, EHRs, maintenance of EHR through transcript is very it is a simplified process. Now, coming to what all tools of medical transcription can be used. So, you can say broadly, uh, for the medical transcriptionist, they rely on two broadly, they rely on two main groups. What are those? First one are speech recognition software. So speech recognition software, which is also known as voice recognition software, basically it uses advanced algorithm to convert spoken dictation into text. This software is basically, especially they are designed for medical field and can recognize vast amount of medical terminologies, which can include drug names, procedures, diagnosis procedure, or laboratory test, or other investigations, whatever a patient goes through. So these software, they have algorithms and they can recognize all these terminologies. What are the benefits of this software? It helps in improved accuracy and it reduce errors, especially when we have certain common medical terms. So it is very like easy for this software to catch those medical terminologies. Also, it helps in increase efficiency and productivity for transcriptionists. Another benefit of software is it helps to reduce workload for physician by allowing them to dictate reports instead of actually typing them, and like lot of time consumption. Few example of software are Nuance Dragon Medical One, M-Modal Fluency for transcription, and Deep Scribe. Okay. So I think in your PDF, only Deep Scribe is there. So just try to note it down. I have highlighted them. Now coming to transcription software. So these transcription softwares, they provide a dedicated platform for medical transcriptionists to listen to audio recordings and then type the transcribe text and edit the document. It actually offers a variety of features which are designed to streamline the transcription flow. Now, coming to benefit of transcription software, there are many features like food pedals, hotkey, which facilitates for hand-free control of audio playback and to improve efficiency. Now, another benefit is expandable capacities, which includes integration with EHRs or electronic health record, so that there is a easy access to patient information. The one of Another benefit of transcription software is they act as tools for managing large volume of work and prioritizing tasks. Some of the example of transcription software are yeah okay are Express Scribe, FTW Transcriber, and InSQ Scribe. Okay, so there are three examples for these. So along with these, a medical transcriptionist, they require certain other things also to do the process. What are these? So they need proper headsets. Okay, headsets play a very important role because most of one of the important thing is listening. Okay, so nowadays we have headsets with noise cancellation feature. They help for improved audio quality and also help in reduction of any distraction, because from any noise which is coming from outside or other medical distractions while other people are talking, or for example some other patients are there, caregivers are there. So this basically helps in focusing for that. Then ergonomic keyboards to prevent discomfort because the work involves listening and typing. So it is very important that user-friendly keyboards are placed so that patient can the transcriptionist can focus on work. Then dual monitors. It helps in viewing of source material and also transcribe text. So the medical transcriptionist, he can have a visual control over whatever they are like transcribing and whether the text has been accurately transcribed or not. Next is reference material, because the job involves certain medical terminologies. So it is very important to have medical dictionary and other online resources which facilitates accuracy and consistency in terminology. So all the tools which I have mentioned, uh, in which we have transcription software, speech recognition software, and all these hardwares like headsets, ergonomic keyboard, dual monitor, or reference material. These basically help, and along with them, the expertise in medical language uh, helps medical transcriptionists to ensure the accuracy and completeness of patient medical record. Now, coming to medical transcription skills. Okay. So, if a medical transcriptionist want to transcribe the information in an accurate manner, they need to develop well-rounded skill set, which includes technical skill, medical skill, and certain personal qualities. So, in this table, you can see there are certain categories of skills which are required by medical transcriptionist. These basically include technical skills, medical knowledge and research skill, other important skills, and some personal qualities uh, to improve and have work efficiency. We'll be discussing them in detail now. So, talking about technical skills, any medical transcriptionist, they have a good typing speed along with accuracy. So, they need to keep a pace with whatever is dictated to them. They are supposed to listen, and at the same time, they need to convert those vocal records. So it is important that they are very fast, along with that also very accurate in typing, and they don't miss any information. Now, coming to computer literacy, it's not only like typing and accuracy. Along with that, they should be computer literate. They should understand any software they are using for transcribing, and they should understand various word programs, and also like how to maintain EHR. Nowadays there are many EHR specific softwares in the market. So any transcriptionist, they should be well versed with the software. Their training, hands-on training should be done, and they should be like efficient about that. Next is familiarity with speech recognition software. So how to use this so that uh, they can be more productive, and basically it will help to improve efficiency and accuracy. So this was technical skill. Now coming to medical knowledge and research skill. So medical terminology. It is very important for medical transcriptionists that they understand medical terminology. Only then they will be able to understand about various information which are dictated in the vocal records. This might include many anatomical health concerns, certain prescribed medication by doctors, or some investigation or procedures which are mentioned by doctors. So they should be well versed about these medical terminologies. Then, uh, in today's era, when there are so many advancement in technology and also in diseases, new certain so many emerging infections are coming, so many uh, like uh, things are coming up. In that case, uh, they should understand, if certain unfamiliar thing is coming up, so how they can like they can come and they can understand these, how can they do research about these things. So it is very important, that instinct is very important, how they can go to find out information about these things. Now, knowledge of medical abbreviation. Medical professional, they use vast amount of abbreviation. Familiarity with common medical abbreviation is necessary, because doctors, they tend to write many abbreviations to save the time. Sometimes they speak many abbreviation in their medical language. So it is very important that transcriptionist, he understand that what does these abbreviation basically means. Now, coming to other important skills in case of transcriptions. So, as it is a game of listening and typing, so active listening is very important. If the person is able to focus intently on audio recording and discern, then even like some subtle details, it is very crucial. Like he is listening each and every word of the dictation, so that he is not missing any, the person is not missing any relevant information, and nothing is left out. Coming to attention to detail, um, each detail, it should be error free. How it can be done? Only by keeping an eye for each and every detail, and to focus on all minute detailing. So attention to detail is very important. Also, grammatical, punctuation and editing skills, they can help in accuracy. So, if a transcribed report is grammatically correct and clearly written with all punctuation, then it is very it can act as a resource for communication within the healthcare system. Sometimes grammatical errors, they might confuse the user, and sometimes even the lack of punctuation also change the meaning of the sentence. So it is very important, like all grammar and punctuation are in place. Next is time management skill. So, medical transcriptionists often work on tight deadlines and need to manage their workload effectively, because there is a lot of listening and typing. So, they might get exhausted, but this job profile is required focus. So, they need to see, and of course, because this information act as a ready reckoner for patient treatment. So, like uh, this job profile needs to be on toes. Like all information has to be transcribed in a time bound manner. Next is ability to work independently. So Basically, this job doesn't require a teamwork because it is about like listening to vocal records and transcribing them. So this actually also give an opportunity to transcriptionist that they can manage their time in effective manner, and also it helps them to meet their deadlines. So these are certain qualities like technical qualities, some important skills. Now coming to this personal qualities, this is like one of the important portion in this. The person who are transcribing the information, they should have strong work ethics. Why? Because uh, they have to maintain focus and accuracy over extending period. So it is very important that they are honest with their work, and they just don't I mean, if they get worked up, they don't like compromise with the quality of their work. Discretion and confidentiality. So, medical records, they basically contain confidential information and human information. So, there are many regulatory and SOPs around this. Confidentiality about the treatment procedure, diagnosis has to be maintained. And these are very important and sensitive medical records. So, any transcriptionist, they need to maintain this confidentiality. Also, this field, it is like constantly evolving field. Medical field is like constantly evolving. So it's like as new advancements are done in healthcare, so is the, like you can say, dictionary or vocabulary. So transcriptionists need to meet the pace, and they need to like go with the flow and learn all the like procedures. If any, like for example, if any new procedure, new drug, new diagnosis technique is coming in the market, they need to be updated, they need to know that. So if a transcriptionist can basically want to position themselves in successful career, they can follow on these personal qualities and these skills. Along with them, there are certain few other aspects which medical transcription in medical transcriptionists should consider. These include understanding of regulatory compliance. So, medical transcription, it actually falls in umbrella of healthcare data, which is which has to abide various regulations. So there are certain regulations like HIPAA, which is Health Insurance Portability and Accountability Act. This is very crucial act for ensuring patient privacy and data security. So there are many protocols in this for management of medical record. So a medical transcriptionist should be aware about these regulatory compliances. Staying up to date with medical advancement. So as I discussed, like there are constantly this field is evolving, and there are new technologies, medications, procedures which are like which are coming up day by day. So medical transcriptionists, they should strive to stay up to date with these advancements to ensure so that they can accurately transcribe related information. This may also involve attending certain continuing education courses or workshops focused on medical terminology update. So, a medical transcriptionist, they have to attend multiple training to keep them updated, to learn all these medical terminologies. It is very important part of medical transcription. Now, what exactly happens in a medical transcription process? First of all, there is a dictation and recording. This is done by healthcare professional, which can be a doctor or nurses. What exactly they do here? They dictate patient information using a digital recorder or sometimes software. And this information includes clinical summaries, surgery notes, medication, patient history, and lab results. In the next step, there is secure transfer. So, the health care professional, or sometimes it is also some transcription services, they secure the recording into medical services using a HIPAA complaint method. This can be a secure online portal, encrypted email, dictated transcription platform. Coming to assignment and preparation, medical transcription service. So, it includes recording assigned to a qualified medical transcriptionist based on their specialty, because as we have like multiple departments in healthcare, so there are specific transcriptionists which understand these medical terminologies. For example, if a medical transcriptionist is he might be specialist in oncology, and the other might be a specialist in pediatrics. So depending upon the specialization of medical transcriptionists, the recordings can be transferred to them. The work can be allocated as per the specialization. Now, coming to transcription, what exactly now happens? So this is done by medical transcriptionists. They listens to recording using specialized software, and they use features like foot pedal and certain integrated medical references. They type information accurately with all medical terminologies. They take care of all grammatical punctuation, and sometimes they also use speech recognition software for assistance. But they might use it, but ultimately it is their responsibility. Whatever information is uh, like is converted, it is accurate, and it is the information is accurate. Now, once it is done, then again editing and proofreading has to be done by medical transcriptionists. So now, once they have the transcribed document, they need to carefully review the document for if there are any errors in form of medical terminologies, grammar, or punctuation, and they need to rectify them, and they can refer to material. And also sometimes in case of doubt, they can ask to the dictator about the errors. Now, quality assurance, this is optional, but it is optional, but it is recommended. So senior medical transcription, for purpose of monitoring, they perform additional quality check to ensure that there are accuracy and standards are followed, and there are no errors in the report. Also, after that, once a quality assurance check has been done, then comes the delivery, and the transcribed report is delivered securely back to the healthcare facility. And then these transcriptions, they are uploaded on electronic health record system. Okay, so this is a step-by process how medical transcription is done. Now, medical transcription in India. So, India is a major player in this industry. Why? Because most of the transcription work, it is outsourced. Okay, so India is really doing a good job, and it is one of the key player of this market. Why? Because as we all know, we are we have a huge workforce. Okay. And many, like most of our population is well versed with English, and they have like a strong educational background. So this human resource, uh, basically it helps in medical transcription. They work in that field. Second is competitive rates. So generally, the cost of medical transcription in is low in comparison to other developed countries, and that is why many healthcare facility, they look for cost-effective solution. Uh, so many like agencies from US or UK, they like hire people from India to go into this transcription. Technical expertise. So Indian IT sector, it is very well developed, and many companies, they play an important role in medical transcription services, and they basically invest in technologies like speech recognition software to improve the efficiency. Now, talking about applications in India, so if we talk about like outsourcing, so many Indian medical transcription companies, they cater to hospitals, clinics, and other healthcare facilities in developed countries like US, UK, and Australia. And one of the like you can say very comfortable kind of feature of this job is that you can do it remotely. So that is why this outsourcing can help, because the job profile is remote. Now coming to domestic market, so now in India also, maintenance of electronic health record is emphasized. So there is a opportunity for a domestic market also. By transcriptionist, the transcriptionist, they can get job, and they can basically support hospital, clinics, research institution by creating accurate medical record. If we talk about like career opportunities in this field, so there may be many job roles: medical transcriptionist, okay, the person who is actually transcribing them accurately into written documents. Then quality assurance specialist, they basically review the transcribed reports. It's like the double check. This person does the double check for accuracy, completeness, and adherence to style guides. Then there are project manager who basically um, see the accuracy also, and they act as a bridge between the hospital or the agency and also the like workforce who is doing this, or transcription agency. They basically act as bridge, and also they ensure that yeah, like the delivery is timely, and they manage client relationship. So, till now, we have been going through like what are the benefits, or how it is helping, it is acting as a wonderful aid. But of course, there are certain challenges. Like, uh, first of all, data security, because we are using so many softwares, we are using network. So, the patient data is subjected to security and privacy issues might be there. So, as I told you, like these records, they contain sensitive information about patient. So, ensuring confidentiality is very important. But there might be like it is subject to like misuse of this information. So uh, they need to also in India, the medical transcriptionists, they need to comply with the many data security regulation, especially for US based clients. Then as we have a huge workforce, so is the competition. This market is very competitive, uh, because other countries also are into the industry, and it is very important if to maintain quality and cost effectiveness if you want to survive in the game. Coming to regulation, so clear and consistent regulations which govern the medical transcription industry in India are very important to ensure quality standards and protect patient privacy. So, with all information which I shared with you, we can say, like, overall, medical transcription, it offers significant opportunities for both, like employment and healthcare improvement in India. But we need to address challenges which are related to data security and regulations, for which are very important for continued growth and success in this sector. Okay, so like this, all this cover your this topic. Just a second. I try to cover everything. Can you see my screen?
Yes, ma'am.
Okay, so I try to cover almost everything which was mentioned in your syllabus. Okay, I have covered all these things.
Ma'am, the entire syllabus is covered, right?
Pardon?
The entire syllabus is covered, right?
Yeah, yeah, yeah. This topic, this particular topic is covered. So, just a second. So we have completed till 3. Okay. Tools of transcription and transcription skill. I have covered both the topics, and I have also given little bit about Indian scenario if you want to improve it or write about that. Okay, but whatever was given in the syllabus, it is covered in this.
Okay, ma'am.
Okay, so tomorrow we can discuss about ethical and legal responsibility and confidentiality.
Okay, ma'am.